मेरा नाम डॉक्टर नितिन सूद है और मैं मेदांता हॉस्पिटल गुड़गांव में हीमेटोलॉजिस्ट हूँ. Today I'm going to talk about the advancements in the field of hematology and hemato-oncology. So if you stick with me for the next 2-3 minutes, I'll give you a brief update on what new treatments are available for our hematology patients, especially the ones who have hematological cancer. So as you know, treatment for hematological cancers is very effective anyway, but to make it more effective and to offer treatment to many patients who can't have treatment and to reduce the toxicity of treatment, there have been many advancements over the last few years. Some of them are a new form of transplantation called haploidentical transplant. And haploidentical transplant is a new way of doing a transplant where patients who traditionally can't find a donor will have a donor, because here we are not trying to fully match the donor with the patient, and we are offering a half match transplant. In recent times, there have been new techniques developed to make this kind of transplant less risky and more effective for many of the malignancies. And most of the patients who don't end up having a sibling or a matched unrelated donor can have a haploidentical transplant. The other form of modality which is making headlines in recent times has been CAR T cell therapy. And CAR T cell therapy is a form of treatment where we harvest the patient's lymphocytes and modify them outside the body to make them recognize and fight the cancer more effectively. And this is a form of treatment that has become more accessible recently and less expensive, because we have developed indigenous CAR T cells which are now approved for treatment for many relapsed lymphomas and relapsed leukemias. The other modality of which is going to be talked about more often nowadays is something called bispecific antibodies. And after targeted therapies and immunotherapies, bispecific antibodies is another new way to target cancer antigens. And it doesn't target one antigen, it targets two antigens. And typically it targets one of the cancer antigens and one antigen from the lymphocyte, and brings them close together so that the lymphocytes can fight the cancer more effectively. Most of these treatments can be availed at Medanta, and they are effective, and please talk to your doctor about how to access these treatments either within a clinical trial or outside a clinical trial as a standard mode of therapy.